In this country, the flu has reached epidemic proportions. The CDC reported today that the virus is now widespread across the entire continental United States. 20 children have died. Just over 100 died last flu season. Here is our chief medical correspondent, Dr. Jon LaPook.
In Ohio, Richard and Valerie Reben are mourning the death of their 4-year-old son, Jonah, from flu. He had underlying health conditions.
One of the most difficult things that I've ever had to do was tell my other children on Saturday morning that their little brother wasn't coming home.
The CDC reported 20 pediatric deaths so far this season. At this time last year, there were 3.
There's a lot of flu happening right now.
Dr. Dan Jernigan is the director of the CDC Influenza Division.
We saw that the season started early back in November and has had a really rapid rise and is probably peaking right about now.
Flu peaks most often in February. Of the 49 states where the flu is widespread, these 36 are the hardest hit. California has had 42 adult deaths, up from 9 last year. Kentucky, 36 deaths, up from 4. And Oklahoma, more than 4 times as many.
This year, the predominating virus is H3N2. And in years where that one is the most common virus, we see a lot more hospitalizations, a lot more cases, and also more deaths due to that particular influenza virus.
That strain disproportionately affects people over the age of 65 and children. Hospitalizations in those two groups are rising.
The numbers of people being hospitalized is really doubled in the last couple of weeks.
There are still about 3 months left in the flu season, so it's not too late to get a shot, which takes about 2 weeks to become effective.